Welcome to the Spiritual Care Community of Practice. Today's session will be on spirituality of grief and bereavement. And we have our guest presenter today with us, Matthew Fillier. Before we get into our presentation, I would like to take this opportunity to acknowledge that the land on which I am presenting from, the city of Ottawa, is the traditional unceded territory of the Algonquin Anishinaabe people. I acknowledge the historical oppression of lands, cultures, and the original people in what we now know as Canada, and we are grateful to have the opportunity to be present in this territory. Briefly, the Palliative Care ECHO Project is a 5-year national initiative to cultivate community as a practice and establish continuous professional development among healthcare providers across Canada who care for patients with life-limiting illness. I urge you to check out our website, echopalliative.com, if you'd like to find out more about upcoming sessions. The Palliative Care ECHO Project is supported by a financial contribution from Health Canada. Therefore, the views expressed here today are not necessarily the views of Health Canada. Many of you might know Pallium for our LEAP content, our LEAP programs, such as LEAP Core, which is an interprofessional course that focuses on the essential competencies to provide a palliative care approach. It is taught by local experts who are experienced palliative care clinicians and educators, and can be delivered online or in person. Please feel free to visit our website at pallium.ca to find out more about our LEAP programs. As you can see, today is our 5th session in this second series with the Spiritual Care Community of Practice. A few welcome and reminders. I encourage you to please introduce yourselves in the chat. Your microphones are currently muted, and there will be time towards the end of the session for any questions. When you do have questions, I urge you to please populate them in the Q&A, and they will be addressed by our presenter or our panelists towards the end of the session. Remember not to disclose any personal health information, and the session is being recorded and will be emailed to all registrants within the next few weeks or so. Regarding the disclosures, Pallium Canada is a non-for-profit organization partially funded by Health Canada. We also generate support for operations and research and development from the sale of our palliative pocketbook, as well as course registration fees. So I myself, along with our presenter and our panelists, have the disclosures that you see before you. And our presenter had complete independent control over any content that you will see here today. I'll jump right into it with the presentations. My name is Diana Vince. I'm the Palliative Care ECHO Project Manager at Pallium Canada. I will briefly now hand it over to our presenter to allow him to present himself.
Hey everyone, thanks for having me along for the ride today in your community of practice. My name is Matthew Fillier, he, his, and I'm an ordained minister in the United Church of Canada for about the last 16 years. Currently, I work for Nova Scotia Health, which is our provincial health organization in the Maritimes here in Nova Scotia. And I work specifically as the grief and bereavement practice lead, which is a new position in the organization. I work through what's called the Palliative Care Network, which is its own kind of interesting thing that we could do a presentation on in and of itself, how that fits our organizational landscape. But the long and the short of it is I help with our provincial response to the mass casualty, as well as wherever grief occurs across the province, and in scaling up a practice support program for grief and advise on content creation and programs and standards for all of our clinicians and our workforce and volunteers at Nova Scotia Health.
It's wonderful to have you with us and to join us today, Matthew. I'll now give it over to Sheila, if you can briefly introduce yourself.
Hi, can you hear my voice okay, Diana? Perfect. My name is Sheila Atkinson. I am a certified spiritual care practitioner by background training and many years of experience. I'm also a registered psychotherapist in Ontario, where many of us align for our accountability to college. And I work currently in what I'd call an interprofessional or kind of hybrid role where I am a grief support coordinator at Sick Kids Hospital in Toronto. We support all families who have had a relationship with sick kids at any point when their child has died, and particularly supportive parents, grieving parents for what is often a very long journey. So I integrate all those skills and bring them into that place, also staff support and education as well. Thank you.
For joining us today, Sheila. I will now pass it along to Christine. You're muted, Christine. There you go.
Did it again. See,
No, it's
it's a
okay.
habit I have. I'm Christine from Edmonton, Alberta, and I'm a certified spiritual care practitioner on the tertiary palliative care unit at the Grey Nuns Hospital. And it is a special unit for support for pain and symptom management and psychosocial spiritual needs in the Grey Nuns Hospital. So I'm glad to be with you today.
Wonderful to have you with us, Christine. So now, without further wait, I will pass it along to Matthew to continue the presentation.
Well, thanks, Diana, for having me, and thank you, everybody, for letting me be a part of the ride here in your series on spirituality and grief. We're going to cover a lot of territory today in about 40 minutes. I've got an ambitious agenda, but we're going to do it. First thing we're going to do is set some context for loss and grief from my vantage point of working provincially here in Nova Scotia. I'm going to unpack a little bit of the dominance of stage theory because I run into it a lot in our work and our context here in the system, as well as with communities, and relate that briefly to grief and trauma and what we've learned there. And then I'm going to propose we kind of look at grief from a non-pathological embodied response, and finally going to sew it all up with spirituality, meaning, and identity. Easy peasy, right? No problem to do this in 40 minutes. Here we go, everybody. So just going to see if it'll advance here. There we go. So friends, whenever I do, work with groups, I use this slide, and there's two circles I want to draw our attention to today. One is the choice circle. I am going to talk about the mass casualty and some natural disasters and other things that could activate you in terms of whatever your history with loss might be. I don't know where you're coming from or where you're going, and so I don't like to surprise people with that. So just want to offer that you always have choice to engage or not in the presentation. And so pay attention to that white circle of just being aware of what's showing up in your body today. I know we're talking about grief and spirituality in a conceptual level, but hey, we're going to be sharing personal stories too, and that can stir a lot of things for us. So just care for yourself, do what you need to do. Let Diana know and my fellow panelists, if you need to step away, but just want to keep that in mind as we go through the presentation today. One of the things I really like to do together is this, because it's one of the things that's neglected the most with grievers, is to just take a moment to name, if we feel so moved, how that grief is showing up for us today. So if you feel like it, feel free to name a loss, whatever and whomever that might be for you today in the chat. And if you don't want to name it out loud, you want to keep it inside, that's okay. But I offer you that moment and that space among us as a community of practice to just acknowledge what could be showing up for you today. I will name it the group for me today. My father-in-law has a serious illness. It's terminal. He will eventually stop breathing because of how this is affecting his lungs. And we're the sandwich generation, my partner and I working with him. His primary caregiver is his spouse, my mother-in-law, cancer survivor, liver transplant recipient. A lot going on there for us as we work through that. But that's always somewhere as I show up. So I just invite you, if you feel so moved, let's just take a moment, name for each other. If there's something that's a loss, whatever and whomever it might be that's showing up for you today, you'd like to name.
Feel free to use the chat to share, or there you go. We have something coming in.
Yeah, thanks, Janice. Your mom. thank you to everybody who shared in the chat. And I'm sure if you're like me, you're watching that. And one of the things that I find that's really important for us to do together and to do more of as colleagues, as people engaged in this work, is to make space for our grief and our loss to be named. Because one of the greatest things that grievers experience is that isolation and aloneness that, you know, this grief is just mine. This suffering is just mine. It's affecting me, and everybody else's life seems to be going okay, but mine is a hot mess, or I'm struggling with this. And the reality is that, of course, everyone around us is carrying grief. Uh, these people, these experiences we're naming, and thank you. It's so rich in the chat there, everybody who's sharing that grief is not a problem to be solved. It is an experience to be carried, and a lot of us are carrying grief. So you might have seen this survey before, but here's this survey of almost 4,000 Canadians right across the country from the Canadian Grief Alliance. And no surprises here about how people are carrying grief. 50% don't feel adequately supported in their grief. More than half don't even think it was adequately recognized. In terms of themes, we see results saying people want a dialogue, a conversation about grief, and they don't want it just to be about person loss. There's this disconnect between what people need and how others respond in our culture and society. People's expectations of support aren't really being met. And then there's this, hey, support doesn't mean one size fits all. Like, we don't need to act as if grief is the Oprah Winfrey show of saying, you know, you need therapy and you need therapy and you need SSRIs and you get them too. Those are all really important things. But it's not helpful to say that everybody needs those things all the time, that we really want to think about the person in the midst of their grief and their context. Just to sort of bring this to light for us today, if you haven't looked at the grief multiplier research out of Johns Hopkins from COVID-19, this is fascinating to me, indicating that for every person who died, there were 9 people who were affected by that loss, who were grieving. That accumulates to 60 million people on the planet from COVID alone. If you take those numbers and you think about person death in Canada, that's just one aspect of loss. That's almost 3 million of us in 2023. We're not that big a country. So you start to paint the landscape of just how prevalent, how present grief is all the time. That's going to be important for us today. Also want to draw your attention to that gray box that when grievers are accessing healthcare systems, employer resources, and helplines, they're saying, this isn't helpful support. It's not perceived as support, which is a really important change. From my vantage point in my role at NS Health, in Nova Scotia, and I hazard to guess this is true for most of the country, how many colleges, universities require healthcare practitioners of any kind to have grief-informed training before they basically jump into a career of swimming in an ocean of grief and loss? In Nova Scotia, that's 0. So I'm really not surprised to see a correlation here, and I'm pretty sure there is. It's a big missing part of what's happening. This is a rhetorical question for us, given the timelines we have today, but I always ask groups that I work with, and I've trained about 1,000 now, what comes to mind when you hear the word grief, right? And you know, what images come to mind, what thoughts, what emotions, where does this resonate or live in your body when you think about grief, when you reflect on it? And you'll hear everything about the word grief. You'll hear, you know, existential dread, despair, fear, sadness, depression, all of that. You'll also hear hope, meaning, purpose, possibility, transformation. And you'll hear people who say, I don't feel anything at all. All of that is grief. There's nothing wrong with any of that. That's just how people grieve. And that's such an important piece to recognize in the culture and society in which we live. And one of the most popular things that people will respond with about grief and what's familiar to them is the stages of grief model. And here's a simple representation of that. You know, Taylor Swift, arguably most impactful musician on the planet right now, has a stages of grief playlist. So I encounter kids in Generation Alpha who understand what a stage of grief is and how that relates to what's happening in their lives. This is deeply embedded in our culture. It has incredible staying power. I'm not a proponent of stages, full disclosure. And I'm really fascinated and curious about why people carry this so deeply. So just asking this rhetorically today, maybe we can have some time at the end there, but I wonder if there's helpful things about it. And respondents to me to that question have said in sessions, Matt, I really like that we named denial, or I feel guilty about the fact that I'm angry, and it's refreshing to see anger named as a possibility for me. So there's some kind of validation there sometimes for people. Over and above, head and shoulders above, is this idea that people respond with, look, it's less than a year. That is light at the end of the tunnel. And I need to be able to see that, and to know that, to have hope. Other people will say, hey, in this wilderness of grief, and I'm an ordained minister in the United Church of Canada, I would put it this way. If I'm in this absolute hell of a place in my life with my loss, and someone hands me a map that says, here's 5 milestones of how you get out of this place of existential suffering in less than a year, I will punch that ticket, right? I can see the appeal of it, but I wonder if there's anything harmful about it. And from my vantage point, there's a lot that's harmful about stages, but no matter how it's presented. So Nova Scotia, I don't know if the rest of you are aware around the world or in the country, but our province in Canada is going through a lot of grief and loss. In the last 5 years, this is by far an incomplete list, but take a look at this. Who would say to anybody who's gone through this, lost their home in a fire, watch a neighbor lose their home in a fire, had a member of their community swept away in a flood tragically, had one of 22 people in their community violently murdered, would say, in 6 months to a year, you should be really moving on. You really shouldn't be thinking about that person anymore. It probably means there's something wrong with you. Stages does not cut it for what our province is facing. And unfortunately, it's the dominant cultural and social box that we kind of cram grief into. Down there at the bottom of the list, we've had 6 women killed in intimate partner violence in the province. That's an exponential increase. But also, if you're familiar with trauma and violence research, not unexpected given the mass casualty that we went through. Worst mass violence in the country to date, and it happens in the middle of a pandemic, the likes of which no one has ever seen, because the world has never been so interdependent and interconnected as it is today, right? There's no real comparison there for me when we look at pandemics. So both of these are multi-generational impact events, right? But we're going to put a clock on it of a year or less. So I really don't advocate for time being a measure of grief, but I really do believe meaning is, and especially when we talk about spirituality today. I love Gary Andrews' cartoons for lots of reasons. He worked for Disney as an illustrator. His wife died of serious illness, and when his daughter was quite young, and he's been chronicling that journey. And you see this cartoon is entitled The Evolution of Grief, and just think about that in terms of time. Evolution happens across many, many, many generations, right? Like in that sense, for us, time is really irrelevant. But look at how he has to name time right away. 1 month, 6 months, 10 months. The devil on his back, who's ripping his heart out of his chest as the oppressor, turns into his best friend, his companion in 10 months. Now, this is Gary's experience, which is beautiful. And there's deep meaning in those images and those words and the way he's articulating his journey. But I bet you those arrows are a lot more multi-directional than this cartoon is telling us. That grief is not linear. It doesn't have a beginning, middle, and end finish, and it's over. It's not a race. It's dynamic and it's fluid. It's like, a great big traffic circle. And grief is a universal phenomenon, I think, for human beings, just like breathing. I don't think it's any different than that. But just as no two people share the same fingerprint, not even your identical twin, that's also true with grief. Your grief is the imprint left by everything that makes up your loss as a person, as a human. Lots of you, your mom may have died of serious illness as well. And we can talk about that, but no one has the relationship I have with Audrey Cooper as her second son. That is our relationship in our context. And so the danger with what we see in this presentation is saying, this is true for everybody. So we end up comparing, hey, it's been 10 months. My son died in a tragic car accident on Sunday morning. And, here I am 6 months in. Shouldn't the devil on my back now be my best friend? Why is it not feeling that way? That comparison and generalization is not helpful. We have to put the person in their context at the center of their grief. So in terms of evidence, here's that scoping review by Strobschut and Boehner, right? That concludes, look, we can see that this has done harm to people who don't experience stages of grief. And also, it's really important, but it's part of the evolving theory of grief. And there are other theories we can draw on that are much more relevant, especially when we're looking at grief in the way we are today with spirituality and making meaning. And I guess an example I would use here would be, so my mom died of primary biliary cirrhosis of the liver when I was 10. And I remember after she died, I went to go play with my friends in their front yard, and their parents happened to be out cleaning up the yard that day. It was in the fall. And so I come over, and the parents say, Matt, what are you doing here? So, well, coming over to play. And their piece was, your mom just died. You should be home with your family. My friends were saying, I would be crying. Why are you here? For them, that dominant mode of what mourning should look like, what grief should be, they were translating from their adult view and from their societal view to me as a kid. And that's the trouble with when we have these sort of grand, sweeping, dominant boxes that we jam people into. What we know now, of course, with childhood bereavement and grief is that that's very typical for how children grieve, right? But just showing us we've got to be really careful with these pieces. They can do a lot of damage, especially when it comes to grief and trauma. So we talk about timelines and that incessant belief that time is king in our culture in the West. Time is money, time is meaning, time is productivity, time is the great sort of regulator of everything. And it doesn't play well with grief. So we know from violence and disaster that survivors and the bereaved can report elevated anxiety and depression 26 years after the event. You will also see marked reduced levels of social support and how the trauma and the grief continues to impact their ability to create new attachments and relationships, which is essential in what we're going to look at today. So these outcomes of grief and trauma where they intersect are really important. I mean, increased mental health issues, including PTSD, among others in the population. We're going to see social fragmentation, especially in small rural communities in Canada. We're going to see economic decline, escalations in violence and crime. Domestic violence is one of those markers, which we're seeing right now in Nova Scotia. Intergenerational trauma, which, my Mi'kmaq neighbors would say is not going to be over in less than a year. Reduced civic engagement and trust in institutions, a lot of suspicion. Chronic grief, which is a huge issue, right? Of this inability to create meaning out of what's happened, to find hope and possibility in life, and to reconstruct who we are now as a community, who am I now as a person. That's really challenging in this environment. So one of the things I wanted to lift here for the group is this shift in traumatology that occurred quite a while ago, but grief world seems to be slow to catch up, which is traumatology really moved from saying, hey, what's wrong with you? You're exhibiting abnormal behavior to this normal situation. So you're falling outside of our paradigm of what's acceptable for human behavior. And now you're ill. There's a problem with you that we have to fix or diagnose. Traumatology moved away from that approach and began asking, what's happening to you? Do you see the shift in the difference? Instead of saying the person is the problem, it's saying we need to understand this context. We need to understand how this is impacting the person and stop treating them as the problem. And no one put this better than Viktor Frankl, right? Survivor of the Holocaust, wrote Man's Search for Meaning, which I consider pretty much timeless as a psychiatrist. And he said, look, an abnormal reaction to an abnormal situation is normal behavior. The greatest task for any person is to find meaning in their own life. And what we see with grief and loss, of course, is how meaning and purpose can be challenged deeply in identity. And so we have to work through that lens. If you're wondering, hey, the world is starving for meaning right now. Why are people showing up the way that they're showing up? Why are people on edge the way they are? Look at the cataclysmic slate of crises on the planet right now that are intersecting. We're all basically taking a big bath in this every time we open our phone, or on social media, or reading the news, or even if you watched the Four Nations hockey game, it's suddenly a conversation about American-US politics rather than hockey. So we've got the crisis in the cost of living, the crisis of mass migration. There's never been more refugees and people on the move than right now on our planet. The crisis of homelessness, of affording a home, the crisis of global conflict spinning out of control, the crisis of the climate, which in Nova Scotia we're keenly aware of in the last 2 years, the crisis of human rights being given and taken away. And this is not a complete list. I mean, this is a lot of loss that is on a grand scale for our whole society, culture, and planet. And then in the midst of that, those of us who are working in the palliative space as well, we see how that can play out across that blue band. And we could spend all day talking about this line and add more to it. But the one I want to draw our attention to is the loss of the future we always assumed we would have. No one gets up in the morning and says, I wonder if my family member is going to get shot and killed today. No one gets up in the morning and says, when I go to this doctor's appointment, like I wonder, is that going to be like the diagnosis of terminal illness? Okay, I get that some people will wonder that, but you take my point, right? At the back of our mind, most of these things sit. Otherwise, we couldn't live, right? We have to assume some things so we can go about our lives. But when we encounter loss, the suddenness of that forced identity transformation, boom, that comes right up in front of us. And now we've got to deal with it, and it's all we can see. And so many of these things that we assume suddenly start to get pretty shaky. So Frankel also said, if there's meaning in life at all, then there must be meaning in suffering. Because when we pull the camera back, what we understand is just like we did at the beginning of the session, grief is everywhere. It's not just in one individual or one particular place. It's happening all around us because loss, like suffering, in my opinion, is an ineradicable part of life, like fate and death. And without suffering, without loss and death, human life can't be complete. I thought it was a remarkable observation. So that changes how we look at grief because we can say wherever there are people, there's going to be grief because loss is a constant and not an exception to the human condition. So we can show good research from birth that infants grieve, can experience and have loss reactions all the way throughout the trajectory of our lives, even if we're a centenarian, right, in death. And even after our death, those who remain also experience grief and loss, right? That loss continues. It is a consistent part of the human condition. And when we think about this, it doesn't have to be person loss. It could be the loss of ability, of income, of a job, a relationship, a pet, your dignity, your mobility, your language, your culture, your house. On and on we could go, but you take my point, right, as we move across that trajectory of our lifespan. So I like the way the Dougie Center took this kind of idea from Viktor Frankl, and they say, grief is a normal reaction to a complex situation. Grief isn't pathological, it's human, right? And I think that's such an interesting way of putting it that I have yet to meet a person who is simple. I have yet to meet a human being whose relationships are normal, right? And fall in a perfect box that's nice and neat and tidy. People are complicated. Our relationships and our attachments are complicated. And when those are severed, we're going to have multi-layered reactions to that. And I think it's important to see that as human as a starting place first, instead of pushing that into illness. So here's an example that is inspired in our work in the Palliative Care Network with grief. And this comes out of the mass casualty report, actually. The report talks about grief and loss being like a wave that ripples across society and culture on different levels. And so we've kind of taken that and extrapolated a bit. Let me give you a practical story, everyday story of how I see this play out in my work every day. I'm at the grocery store. Everybody who does grief work knows grief shows up at the grocery store for some reason all the time. So I'm at the grocery store. I'm just there for milk and eggs, and I'm in the lineup with the cashier. And I always like to treat cashiers with a little bit extra time and attention and care. I've worked in retail. I know how those people get treated. We learned in the pandemic just how valuable they are. So I go out of my way to always spend some time chatting them up. So I'm that annoying person in the line for you when you're in a hurry. And I was asking this cashier, we're bantering back and forth and laughing. It was a beautiful day in the summer. And I said to her, gosh, what a great day. I bet you can't wait to get out of here. What are you going to do after your shift today? And her face just fell and her eyes filled with tears. And she said, I'm dreading the end of my shift. because I have to take my mom to the Dixon building because she has to start her chemo today. And I don't know how long we have left with her. And I don't know what I'm going to do without her. And then she started immediately backpedaling and apologizing of saying, I'm sorry, I shouldn't put that on you. I'm sorry to be crying right now and apologizing for that. Everybody in the lineup, what we did was we stopped and made space. There was nothing more important than being present. We could be compassionate. We didn't have to judge her or give her advice. We just had to make space for her, to reach out to her, to let her know she wasn't alone. And as we did that together and made space for that, she was able to find her ground and continue on her work. Here we are, in that moment, one person, that loss rippling out into a community of strangers. Suddenly, we're all involved in this. And then that's spreading out into systems. Think about the healthcare system is involved. EAP, I'm wondering, does she have access to those resources? What other social support systems are involved in her life? And how is that going? And suddenly we're building a pretty complex picture here of what this could look like. And then those Western attitudes around, we should not emote our grief in public. That is a private thing that only should be kept in private. You can see how this spreads and ripples in. Sometimes it's waves, sometimes it's a tsunami. But all the way around the circle here, we are going to see grief. So let's talk about loss a little bit then, and how do we look at loss as it relates to grief? And I really like thanatologist Rochelle Bensoussan's work. She has a new book out, which is, I think, very provocative and interesting. And she defines loss as the severing of someone or something to whom we've held great attachment. Now, these attachment relationships are what help us survive and thrive as human beings. They are essential to our well-being. They're not optional. And take a look at this. When we're born, what's the first thing that our medical teams do with that baby? Where do they want to put baby, right? They want to put baby on mom's chest. There's a reason for that. And I want you to see something. Here's some other warm-blooded mammals in my backyard, which instead of being covered with ice as it is right now, this is a much more lovelier scene. But for the deer, right, their babies can get up and run with them very quickly and survive and thrive. But for human beings, there's a reason why we say it takes a village. Because if we don't form those attachment relationships right away from birth, we will die on our own. We're not capable of surviving. We need human connection and relationship, attachments that give us safety, security, and meaning. And so, yeah, it's about regulating our blood flow and our heart rate as newborns. It's also about creating those attachments. Loss of any kind is it validated by the person who's experiencing it, right? So look all the way around the circle, look in that list. So many people experience their loss as disenfranchised grief because it's not recognized by other people. But loss is always valid if you're the one experiencing it. Sometimes I'll say like death is a kind of lost and a loss, and I'll catch myself saying to somebody, I lost my mom. What do I mean by that? I'm trying to soften the blow of that attachment being severed that comes with saying, my mom died. Right? I always play around with that a little bit with people, and I tend to say death much more as an adult than I ever did as a younger person. And a clinician reminded me recently of how challenging this can become when we're dealing with children in particular. Um, they recounted this experience of one of their clients being at the airport being in a pandemonium because she had lost her child. Child had gone wandering, and they were wondering what that was all about. They found the child near a utility closet, looking to see what was happening in there. And they were like, what's going on? And the child said, well, when daddy died, you said he had gone away and that he was lost. And airports are a place where we find people, where people are going everywhere. So I'm looking for daddy. Right? So you can see how that language can be really unhelpful. I want to also say that in Griefland, attachment is really important because we often frame loss in love, right? That we love everyone and everything. Love is the cost you pay for grief is the cost you pay for love. And I can see that, but I can't tell you how many out of the hundreds and hundreds of funerals I've done where I've stood with the widow at the door of the church, and so many people are saying, hey, your husband was the life of the party. He was great. I can't imagine life without him. And her and I know that actually he's been quite mentally abusive. He has addiction. Their life was really, really hard behind the scenes. And then on top of everything, she was expected to be his caregiver in serious illness and care for him until his death. So actually her grief reaction may not be sadness. It could be, but it could be so much more. It could also be hope that it's over. It could be deep grief around, I didn't get to live the life that I wanted to live, right? And now I'm at a place in my life where I don't think that's possible anymore. There's so many things that could be possible there, but we assume it's love. And so attachment gives us a way to move outside of that love language all the time, which is so dominant. So when we think about grief, I like this definition as well. We're not going to spend too much time with it today, but to say that grief is both an embodied and involuntary response. I think this puts the human being, the person, at the center of how we look at grief. Embodied in the sense that it affects all aspects of our life, the physical, emotional, behavioral, social, financial, and spiritual, and that it's involuntary. We have a lot of thinking around grief, like, you've had your bereavement leave, and then you can turn your grief off now, and you can get back to working your double shift and being the super mom and being on Instagram doing your side hustle, right? Um, Grief doesn't work that way. And when we treat grief like a switch we can turn off, that's the people I encounter who are having grief just show up in their lives and be extra disruptive and messy in how they're living and trying to get through. And also to say, like, instead of saying there's a right way to grieve, is just to acknowledge there's your way to grieve. But I think this is a really helpful way of looking at grief. I want to touch on emotions here for a second, because when it comes to spirituality and religion, we often attach morality to judgment. So I work with a lot of people who, for example, will be saying, let's take that example of the widow, of going, I feel really guilty, like I'm a bad person, that I'm happy this is over, or I'm relieved this experience with my partner is over. Caregivers in serious illness often go through these kinds of things, and you can just extrapolate this. And it's working with people to get them to see that, hey, your emotions don't come with a moral value attached in your brain. They're your synapses firing. They're like the weather. Weather's not good or bad. It comes and goes. Sometimes systems stay for longer than we'd like. Sometimes we'd rather be in Florida than to be in Nova Scotia. That's a frozen ice junk right now. But this too will change in time, even though for some of us it takes a long time for it to change, right? But often our spirituality can impose some judgments about that can be difficult. And speaking of judgments with spirituality, is sometimes we can frame spirituality as being, it's hey, if you've got a good spirituality, you're going to do fine with your grief. And this is a mixed bag. And I think spirituality is so important, but we can't lose sight of the paradoxical nature of it. And so let me give you an example. I worked with a woman who's in her 80s and in a small rural community in Nova Scotia. And when she was very young, her best friend and her, they used to always skate on this pond in their community, and all the kids would skate there. And the one rule that the community had was you don't go skating at night by yourself. You certainly don't go skating at night either. And this particular night, her friend snuck out of her house, went skating, and sure enough, fell to the ice and drowned. The morning after, being a small community, being what it will, the body being discovered, everybody showing up, all the families are gathered around the pond. You can imagine what that scene looks like. And the local clergy person was there, and she asked this young girl, would have been about 10 years old, asked the clergy person, hey, why did this happen? And his response was, well, God needed another angel. And that left the deepest scar for her. She was done with church after that. If God requires little girls to die in icy ponds, then I want nothing to do with it. And it plagued her entire life. And by the time her and I encountered each other, and she was going through a different tragedy in her family, we were able to unpack that a little bit, to say, hey, let's untie this a little bit together and realize there are other ways that we can look at the divine. There are other ways we can look at spirituality here that could be really helpful to you. And that was so helpful. It was an accident, actually, that had taken the life of one of her family members. And it really helped her through that, to see that there were other possibilities. But you can sort of see how spirituality can be a both and, in our lives. And so I really like how Dr. Niemeyer puts this, that spirituality isn't a get out of grief free card. I love this quote. We're wired for attachment in a world of impermanence. And spirituality is so beautiful, as we're about to see in a definition I really like, in terms of creating connections of meaning and identity and purpose. And those are essential, given that we want to attach, but the world is always changing. We're always changing around us. And the pace of change right now on our planet is frenetic, right? So he really points out in his work that Spirituality can be an indicator, like really strong, deep, rich spirituality can be really wonderful blessing in terms of thinking about those folks can have greater post-traumatic growth. But it can also be an indicator of having a really difficult grief reaction that's tough to navigate, because you can end up, you can imagine like that young girl, right? For, I mean, 6 decades, 7 decades of her life lived with feeling alone, feeling disconnected from this attachment, this sense of divinity, of the divine, of meaning and purpose, of God for her. That was a door that was closed to her for so long. Such a challenge. So it's a both and is spirituality. It's a wonderful way to look at it. So I really like Tonkin's model that we insist that over time, grief is supposed to disappear. But I like what she does with this of saying that, hey, in reality, we carry that grief experience through. It becomes part of our identity in our life. And we hope and we sort of put our stock in, if you will, that our life will grow and create the capacity for more kinds of attachments. Not that they replace the old ones we've lost, but that we create the ability to find new ones. And spirituality can be essential in that. We don't choose loss. It often is thrust upon us, and that requires us to really change our identity as a person. Who am I now in the wake of this loss? What does the world mean? What is good and bad? All these things suddenly have to be renegotiated, and that's so important. And that's why I like Brene Brown's definition of spirituality. It's pretty simple, and by that I mean, hey, I'm a theologian. I can give you tones and tomes on what spirituality and religion are or not, how they work together. But in my work every day, I see this show up for people. That spirituality is recognizing and celebrating that we're all inextricably connected to each other by a power that's greater than all of us, and that our connection to that power and to one another is grounded in love and compassion. Practicing spirituality brings a sense of perspective, meaning, and purpose in our lives. Most people who are encountering loss and are in the throes of grief are really yearning to find perspective, meaning, and purpose in their lives and to make their way to that. Compassion, I like how she identifies it here. It's the ability and willingness to empathize without judgment and to face pain. I think that's so essential for a reason we're about to see. But that's what we were practicing with that cashier example I gave to you, right? Instead of trying to give advice and to displace what she was feeling and experiencing. Instead, we simply made space to face the pain with her. So we've got this fixation in our culture of fixing, saving, and rescuing grievers. And look at some of these platitudes, which you've likely experienced and said yourself. I know I have. And I really like how my colleague Bianca Newman put this. She's the director of bereavement at Sue Ryder. She says replacement equals the displacement of emotion. And that's one of the challenges with these here is that, we're saying these to a griever, but we're kind of telling them how to feel, aren't we? And in the process, probably letting ourselves feel a whole lot better as well. Trying to make sure that we kind of supersede their narrative. We're replacing what they might say with something we prefer them to think. So here's one that I would give as a quick example here. And we're winding up in time, I know. They're in a better place and they're not in pain anymore. I've heard that so much. That example about a mother's son who died in a car crash is a real one for me. And the community, would constantly meet her and say to her, hey, he's in a better place. I know he was only 17, but he's in a better place. And at least he's not in pain anymore. And eventually that mother had to just lose it on people and say, listen, there is no better place than for my son to be with his mother right now. There is no better place than that, right? I don't care that he's not in pain anymore. I want him here with me. I'm writhing in agony here through this grief. Like, this is not helpful. And she really claimed that territory. I was so proud of her of really pushing back on that narrative. And a lot of these are like that. We've touched on God needed or another angel, or for it's all part of God's plan. I get that for some people that can be really comforting and meaningful. My experience in pastoral ministry is that it's done incredible damage precisely because we're not listening. We're not curious. We're not working and standing and holding a place with compassion. Instead, we're replacing by displacing someone's experience and their meaning or what they're able to articulate about their meaning right now. I want to wind up here with this picture. So I'm looking at it right now on my wall. This is from a mom whose child died of Ewing sarcoma. I was called in the middle of the night and never met them before to come and baptize him before he died. And he was still conscious and able to interact with me. And, as I was going to the house to do this baptism, there was no part of me that was going, I'm saying some magic words that are going to make this all better. The family and I talked about this. There was nothing on their part of going, we think that if you say these words and use water in this way in the Christian tradition of baptism, this sacrament, that he's going up or downstairs in terms of heaven or hell or any. That wasn't part of their worldview. For them, it was about comfort. It was about meaning. It was about for them feeling that they weren't alone and that there was some connection to the divine in the midst of this awful hell they were going through. And that was the most powerful sacrament I ever was a part of that baptism, doing that for him. And his mom gifted me with this picture. And one of the ways that the community works with this grief is every year when he died, people tie blue banners around the trees in their front yard. They're still doing that some 10 years later. And she began to take pictures of wherever she would see a heart around her. And for her, that was her son letting her know that he is present in the world and is still part of the world around her and that she can still interact with him. And so there's a picture of a heart in the sky there. And I love this picture so rich because look at those shadows, those shades of mystery and unknown, maybe things that are fearful, places that are obfuscated by the clouds. There's light there, but sometimes the light is almost too bright, showing things we don't really want to see necessarily. I think this is a beautiful snapshot of someone's grief. And she has a whole wall filled with hearts in her house of where she has seen this happen. Now, is this pathology? Is this, you're living in denial? Is this, you should really be moving on and have moved to a place of acceptance, which is some kind of magic nirvana where you don't remember your person anymore? I don't think so. I think this is really beautiful grief. So, friends, I want to leave you with this as we wind down here that in our culture, we often leave grief to the professionals. And one of the most common things that's said to grievers right now in our culture is, when they're emoting, when they're showing their discomfort, no matter what that reaction is someone saying to that griever, you should really go talk to someone. And the irony of that statement, you and I are having this vulnerable encounter, and I'm telling you, you should go talk to somebody else, a professional. Actually, all of us have a role to play in grief because it is truly a human phenomenon. So I'd like for you to think about it this way. Loss is constant, not an exception to the rule. Grief is an experience, not a stage. Life is a stage. Grief is an actor on that stage with us of our lives, but grief is writing its own script. It might be front stage, backstage, waiting in the wings, or in the orchestra pit. But if you scratch a little with everybody, grief is there. And that compassion is a verb. It's something we choose to do, a space we choose to create around us. So one of the most helpful things I've found that we can say for grievers is this is normal. I'm here too, and I'm listening. I just want to close with this quote from Washington Irving, American writer who says these beautiful words, there is a sacredness to tears. They're not a mark of weakness, but of power. They speak more eloquently than 10,000 tongues. They are messengers of overwhelming grief, of deep contrition, and of unspeakable love. And friends, I thank you for all your combined work in being messengers of grief and loss and meaning and purpose in the midst of people's daily struggles. Thank you so much for the opportunity to be with you all today. And I'll turn things over to Diana.
Thank you so much, Matthew. I think you're giving us a lot to think about. I do invite everybody, if you have any questions, feel free to unmute, ask them. But if you prefer, you can also throw them into the Q&A. I'm inviting, of course, the panelists to weigh in a little bit on all of this. I think there's just so many aspects of this are so important of what you mentioned about giving people space and so many things that I'm gonna walk away with today, I think, on my end. I would say that in the chat, people are agreeing as well. Um, I don't know, Sheila and Christine, do you have anything you'd like to add?
Hi, Matthew. Thank you very much for that presentation. Everybody can hear me now. I didn't move my microphone this time. Um, I think one of the things that just struck me as you were talking was about this statement from Bianca Newman, replacement equals displacement of emotion and meaning. That is so curious because this is
Mm,
such, for the people that are responding to a grieving and bereaved person, this seems like the go-to.
right?
So it just shows like there's something human within us where we doing that seems more normal than not doing that. So
I think you're right, Christine.
yeah,
Yeah, I think it's our instinct, right? Is to
yeah,
want to try to fix, to make
yeah.
this better, right? And it's like I try to draw on and remind myself, my own journey in working with grief, like when I was called for that baptism, there's no way I could fix the fact that this little guy was going to die. There's no way I could fix or rescue or save him or that family, right?
Hmm.
But I could hold that place of compassion for them. And I find often like that's when we turn to those platitudes because we don't know what to do and we're going to do something.
Hmm.
We kind of draw on that. But in doing that, I think Bianca's right. We kind of fill in the blank rather than letting the griever express where they're at.
Hmm.
Um, yeah.
Yeah, yeah. That just tweaked with me today. So much of what we do is that way. Those sentences that you had, um, can't remember exactly what they were, but essentially as alternatives to what you could say instead of, I think Canadian Grief Alliance or Canadian Virtual Hospice had a poster out recently. We've got it up here on the unit. Instead of saying this, try this, like
Yeah, absolutely.
I'm
Yeah.
here, I'm listening. Yeah, thank
Yeah,
you.
and honestly, Christine, that's something that I spend a lot of time on with healthcare providers because they're often, in those one-to-one moments with families, whether it's a serious conversation, as the healthcare organizations like to call it, or not. But there's grief in the room, there's loss in the room, and they feel like they've got to say something. So, like we do a whole series actually of conversation prompts of looking at how do you take what we just told you and then model that compassion in your interactions. And can you remind yourself it's okay to do that rather than to be like, I've gotta fix this? Because I mean, they're healthcare providers. They fix people, they heal people, right? Like they want to make it better, not cause more harm. And so there's that piece. But and it's been interesting because when we do this work with providers, they're able to not only reflect on their clients and patients and chosen families, but that artificial boundary of who's a provider and who's a patient collapses because they're always thinking about their own grief and loss and what that narrative and experience looks like for them. And to watch those things click for people is really rewarding.
Matthew, thank you. I love listening to someone else that I've never known kind of weave these things together because there's new things, there's threads I didn't know about or I hadn't heard said that way. And that's just very helpful. But the one sort of light and not political, but just like us as a universal people comment I'd love to make is your province has a role for the
Mm,
overseer of grief provincially. I believe that at some point Newfoundland also had that. One of our colleagues, Peter, was in that role, I think. But this idea that we take it that seriously, that it has a role, I think is just a statement in itself. And this idea of you saying, I actually am in a position where I'm allowed to ask the challenge question. What we're not training all healthcare people to have familiarity, self-awareness, etc. And so people like myself and like a lot of us in spiritual care, actually, in even
hmm
traditional spiritual care, are in positions sometimes we have the privilege of one by one, circle by circle, team by team, trying to raise that awareness about coping practices. Not just how do we do this and the cheat sheet of comments, but also how do I be in this space with grieving people. So I just I feel like there's this impossible challenge also within the fact that you in that role are speaking to us. There was just a little specific that I wanted just to reflect back on, and it's something I do in our in the HEMONC programs. They regularly have grief support as part of their nursing end of life training when they've been in the position for about six to 9 months. And this idea of platitudes, when I work in a center that is profoundly diverse, and lots of people from lots of traditions where their own declaration of their truth might be, this fits in a greater plan. And so I always help the nurses with that idea. It's kind of an obvious thing, but just to say it out loud for all of us, that
Yeah.
if someone else tells me their truth is that, then I get to lean in with them and say, tell me, how does
Tell me
that
about
help
that.
you? How does that, tell me more. I know that many people fight with grief or fight with loss. You sound like you've placed it within. So help me understand that more. And which is the same principle that we use in all our interfaith things, right? Our multi-faith,
I
our
think that's beautiful,
non-faith things.
Sheila.
But
Like,
tell me how
that
that,
everybody could have that piece. Because what I love about what you said there is putting the person at the center of that,
yeah,
right? Really being curious about, so tell me about that. Right? Why is it that that feels meaningful? And then, like with my person, we got into that and it was deeply damaging. With another person, it is exactly that. My mother-in-law, the beautiful Pentecostal that she is, would say, that's what it's all about. Like that's what's allowed her to cope, through, is to give that over to her divine presence for her would be God, right? And so, yeah, I really agree with that. And that piece around healthcare of really bringing grief into the equation, not just what to say, the kind of cheat sheet thing that healthcare loves because it's simple and quick, but really working into changing organizational culture around grief is what we're really after. So part of the work that we're doing is creating a practice support program, a transition to practice, competencies for everybody in the organization around grief, and skilling and training that up. And then hopefully advocating to other bodies like colleges to say, well, we kind of need to do this before people land, folks. Like, this is really important part of, and spiritual care has often been at the forefront of that. And I see that Peter has his hand up there.
Thank you very much, Matthew. This is really very inspiring. And I'm especially concerned about people who have what I call traumatic or complicated grief. And I'm wondering about triaging in your system. Do you triage for those that really need some deeper work?
That's certainly going to be the goal, Peter, is, luckily some of you will use some version of the Irish hospice model, right? And we have our own take on that of going like, here is this sort of level of grief literacy that we think everybody needs to be aware of and have skill in. Some people are going to need that one-to-one peer support, evidence-based, either one-to-one or counseling kind of level. And then there's that sort of level you're naming there going, and there are people who have other comorbidities showing up at their grief that are going to require some really thoughtful care plans around like, hey, these folks do need other kinds of training, support, counseling, medical intervention that we would see in working with mental health and addictions, for example, in Nova Scotia. So we're developing those relationships now. The reality in Nova Scotia, anyway, is that much like Sheila was saying, is like grief was kind of off the table for a long time. So it took the mass casualty for the province to see, wow, we have to start thinking about this in every part of our province. So the neat part of our model is it's not just healthcare saying we're the be all and end all of a grief support. It's saying, well, grief has no timelines. We can't do that from a resource perspective. We've got to branch out and work with community and develop these networking and relationships to support people wherever they are and however we can. So short answer to that is we're aware of it, and that it's not well supported right now in the mental health system. Certainly, if people were in deep crisis and so on, right, there are ways that you would get flagged for service and support and fast track for it. But at the moment, if you let a call right now in Nova Scotia by saying, I'm grieving, that would almost guaranteed put you off the list because that's not considered moderate to severe mental illness on its own, right? So there's conversations to be had there about how we work through that. I don't want to pathologize grief, nor am I somebody who really earnestly believes, like, no to medication or no to clinical therapy. Au contraire. But I think avoiding that sort of over pathologization, which we have in our culture, is really important.
Thanks, Matthew.
You're welcome, Peter. It's a great question. Something we all struggle with, I think.
Thank you so much, Matthew. I think you're gonna leave all of us. And again, there's a lot of people saying thanks in the chat as well, for such a comprehensive and an awesome session. I invite everybody to please fill out the feedback survey I have left in the chat. Our presenter, along with myself and our panelists, would love to hear what you think about our sessions. A recording of the session will be emailed to registrants within the next week or so, and we invite you to join us for our next and final session of the series on April 8th from 1 to 2 p.m. Eastern Standard Time on the topic of MAID bereavement. Once again, a huge thanks to our presenter, our panelists, and of course, all the participants that have joined us today. Thank you so much, everyone.
Thanks, everybody.